This graph is showing us the active cases per 100,000 in the major metropolitan counties across Texas. We have been lucky. We have worked hard, and we have kept the disease spread down here in Travis County, which is this dark blue line at the bottom of the graph that you're seeing. But what we are concerned about is what's happening in El Paso, in the gray line, and what's happening in Lubbock, which is the blue line. This graph is data through the end of last week, which shows more than 4,000 cases per 100,000 active in El Paso. That number has increased over this week to 4,762 active cases per 100,000, as compared to Travis County at 161. We are not immune from this. We are not immune from a catastrophic surge. And we can see that surge is happening across Texas. It's happening in Lubbock, Dallas, Fort Worth, Abilene, Amarillo, Longview, Tyler, Midland, Odessa. And we're seeing cases rise in Houston and San Antonio and here in Austin. The challenge is that a surge like this in Austin will require us to have more than 600 ICU beds and more than 2,400 hospital beds just to care for the people in our jurisdiction. We don't have that many beds. In fact, when we revised and reviewed our guidance over the summer, we initially had a threshold for transition to stage 4 set at 40. That 40 was based upon ICU beds around 300 to 400. Through working with our healthcare providers and the UT Modeling Consortium, we identified that 200 ICU beds is about the maximum that we can manage, not because we don't have the equipment or the space to put people, but because of the staffing issues. And when we see surge like this happening around the state, those staffing resources are severely diminished, which decreases our ability to pull in other people from other jurisdictions to help care for patients here. Because of this, we have had to transition the thresholds for stage 4 and stage 5. Stage 4 transition is now set at 30 on the hospital admissions on the 7-day moving average, and stage 5 at 50. So this means that currently we have made the decision, based upon the data that we're seeing, the increasing in numbers of cases, which was up to 300 yesterday for the first time since the middle of August, and the increasing positivity, which is now close to 7%, that we are transitioning us to stage 4 in Travis County. This is at a time when we also must consider the fact that we're at a stage where we can still do something about it. We can still affect the increase that we're seeing and prevent a surge from happening, a catastrophic surge like is being seen in El Paso and in Lubbock. To give you an idea of what kind of impact that we can have on that through our actions and our decisions, I've got a couple of graphs here that have been produced by the UT COVID-19 Modeling Consortium. This graph demonstrates in the yellow line what happens if the transmission stays where it is today. And you can see this is a graph of the ICU beds that we would need. You can see that the prediction is that we would need more than 400 ICU beds by February and March. And that number could be as high as 600 or 700. But through our action, through our decisions, through our call to vigilance, which has been renewed, we can cut that down. If we reduce our activity and our exposure by 50% from where it is today, we can flatten the curve out again, as we've done in the past in Travis County and the city of Austin. If we achieve even greater goals of 75% reduction, we can really flatten the curve very quickly and keep it flat until we get a vaccine which is within reach right now. We see similar graphs associated with the hospital admission change. And you can see that following Thanksgiving, there is a significant increase in the risk. And why is that? Because Thanksgiving is a time when we all get together. Thanksgiving is a time where, for COVID-19, we are going to be the most vulnerable. It's effectively Labor Day and Memorial Day and Independence Day all combined into one big event that, unfortunately, due to the nature of the transmission of this disease, poses the most significant risk that we've seen throughout this pandemic. So ultimately, what we need people to do is, number one, if you're high risk, if you're over the age of 65, if you have underlying significant health conditions, you need to stay home. You need to send other people out if you can to go to the grocery store or the hardware store or to help you with your day-to-day tasks. And we also need to encourage everybody, even if they're lower risk, if they're going to be interacting with other people outside of their household, to do so with a mask on and social distanced. We have lots of cases that we've reviewed, and what we are seeing is the same thing that we've been seeing throughout this pandemic, and that is where masks are being worn and where people are distanced, disease is not spreading effectively. Where it is spreading is when people take off that mask and close that 6 foot of distance to be closer to other people. I know it's challenging, but we have to renew the call to action. We're also asking businesses to reduce their occupancy to 25 to 50% to help us mitigate the risk of spread. We know this has been a hard time for our businesses, but we want to keep them open. And the best way to do that is to limit the risk that we have now and keep them functioning, keep them open, and keeping them productive. If we do not take the steps to change now, to mitigate the risk, to flatten the curve, we could be in stage 5 territory in just a few weeks. And we must do all that we can to prevent that from happening so that we can keep our businesses healthy, keep our schools healthy, and keep our community healthy. With that, I'll pass it over.
I want us to remember your older parents, your grandparents, your aunts, your uncles, and others that are a part of your family, the people who you hold near and dear to your heart, the people who you know that they've done so much for you as an individual to help with your growth and development. They're your mentors. They're the people who you look up to. We know that if you have underlying health conditions, diabetes, asthma, high blood pressure, you have underlying health conditions, you are at risk. We want you to really think about how our community has really struggled with COVID-19. We have seen that our people of color, African Americans, and our Hispanic and Latinx populations have really had a difficult time with COVID. We have all lost family members and friends that we hold dear to us. This is the time. Austin and Travis County, we've done this before. We've been here before. It is a call for action for us to move forward and look at our behavior. Take some personal time to reflect about the behavior that you have. What have you stopped doing recently? Are you making essential trips that you were not making before? Are you letting your guard down, not wearing your mask, not socially distancing? I understand that so many people have made so many sacrifices. I know folks that were supposed to get married, changed, their idea of what their wedding plans were. I know individuals that changed their celebrations from their birthdays. And I know so many people have made so many sacrifices. I understand that people are fatigued. This has gone on for quite a while. And I can honestly say we all understand we're living it as you are too. And it is definitely a sacrifice. This year has been so difficult, but we want you to hold on a little while longer. We've got to know that there is going to be a brighter day. We have to know that we are planning. We are a part of Operation Warp Speed. We have put together a vaccine distribution task force, and we are putting together a plan. So we want to be prepared. In the meantime, I want us to think about new traditions. So many of us use social media. Share those new traditions of what a new Thanksgiving and your holidays in December and January can look like. We are a creative community. That's the beautiful thing about Austin. We have so many creative people here. Share those new ideas about the new traditions, because we've got to make a change. We've got to run this race, and we've got to finish strong. And I'm calling us all so we will finish strong. At this time, I will transition over to the next speaker. Thank you.
Thank you very much. Just want to say a couple things in English, and then I'll shift into Spanish. First, don't sacrifice future holidays with your family by ignoring the warnings that you're hearing today from our health professionals. If everyone does their part, I'm confident that we can prevent a crisis here in Travis County, and that means our holiday season this year will be very different from seasons in the past. We need to tailor our traditions with safety guidelines this year. We need to wear a mask, stay socially distant, and wash our hands. And we need to get flu shots. These simple preventative measures can help keep your family and others safe. We really want to avoid stage 5 at all costs. And this starts with having a plan to be safe this holiday. Good health starts at home. No sacrifique futuras vacaciones con su familia por ignorar las advertencias de nuestros profesionales de la salud hoy. Si cada uno pone de su parte, estoy seguro de que podemos evitar una crisis aquí en el condado de Travis. Eso significa que nuestra temporada de vacaciones de este año va a ser muy diferente de las temporadas pasadas. Tenemos que adaptar nuestras tradiciones con las pautas de seguridad de este año. Use una máscara. Manténganse socialmente distante de otras personas. Lávese las manos. Vacúnese contra la gripe. Estas medidas preventivas son simples y pueden ayudar a mantener a su familia y otros seguros. Queremos evitar la etapa 5. Y esto comienza con tener un plan para mantenernos saludables estas vacaciones. La buena salud pública empieza en casa. Y última cosa, la población latina ha sido afectada en una manera más grave que otras poblaciones. Cuídense. Gracias. And now I'll pass it on to the next speaker. Thank you.
Sorry, Judge. Sorry, Mayor. You are muted.
Thank you. First, I want to congratulate Judge Brown on his new office and thank him for getting integrated in this process even before he was sworn in, and how he's jumped in with both feet. We really look forward to your work in this area and your leadership in our community. The judge and I will continue to listen to our public health officials and be guided by the science and the data as we have throughout this pandemic. You know, when we faced a surge following Memorial Day and we entered stage 4 then, we almost reached stage 5, the red area. But our health officials signaled the alarm early enough, and as a community, we stepped up to the plate and we flattened the curve. Made you proud to be part of this community. Our community's effort over the summer helped us fall back to the yellow, stage 3, and we remained there for multiple months. We can get there again, but we need to do it together. Please remember the 3 W's. Wear a mask, watch your distance, and wash your hands. These things work. We have seen them work here in Austin. We know that if we show that discipline, we can impact what happens to us. Going to orange, stage 4 now, is asking everyone to consider your daily interactions. Ask yourself over the course of the day, who do I end up being within 6 feet of? Who do I get that close physically to? Stage 4, orange stage, means we consider that, and now we make an extra effort to limit those close interactions. You know, if there are essential interactions that you can't limit that way, then make sure you're wearing a mask, make sure you're distancing so that we can slow the spread of the COVID-19. The goal here is to avoid overwhelming our hospitals and our intensive care units, to enable our healthcare workers to be safe and to keep us safe and to save lives. We're also going to increase enforcement efforts. People crowding together, people around others not wearing masks, because this is going to take all of us working together in order to protect our entire community. So today, we move to orange, risk 4, because with more discipline, we can avoid red, risk level 5. We can avoid closing schools and more businesses by our actions together, especially over this coming Thanksgiving. We get to decide how badly we want to stop the increased hospitalizations, how badly we want to keep schools open, how badly we want to keep our businesses open. It is up to us. But if we're going to get that done, we have to act together and we have to act with greater discipline. We have control over our future. We've done this before. Now let's do it again. The vaccine is close. We're almost there. We just have to dedicate a little bit longer. Mask, small groups, stay home when you can, and distance. As Judge Brown and Director Hayden said, look at your family and remember who you're doing this for. Don't jeopardize years of future holidays by taking unnecessary risks this Thanksgiving. We need our community to come together again to slow the spread of the virus in Austin, Travis County. We have done this before, and Austin can do this again.
Thank you, Mayor. Now we're going to go over to our pool reporter, Hannah Rucker with KVUE, to begin the question process. Hannah?
Thank you. A good Thursday morning to all of you. Thank you for having me this morning. We're going to start things off with our first question from KVUE. Dr. Escott, I know that you created those graphs there, taking a closer look at El Paso and Lubbock and just some of the serious issues that they are dealing with right now in regards to hospital beds and enforcement. Specifically, what can Austin do differently? I know El Paso tried to implement that curfew. It was unsuccessful, kind of back and forth. What can we specifically do that maybe those cities weren't able to get done?
Well, I think that we are blessed as a community because we can all agree that the science should drive our decisions. The data should drive our decisions. One of the challenges in El Paso is there's controversy, there's conflict between city and county officials. And when there's conflict, people, I think, lose confidence in the message. I think we've had a unified message here throughout this pandemic. We have been grateful to Mayor Adler, Judge Eckhart, Judge Bisco, and now Judge Brown, that we can all come together and provide a unified message. I think that is critical. I think we can't ignore the science, but we do have to ignore misinformation that's out there that clouds the messaging. And the simple fact is that none of us want to close businesses. None of us want to close schools. That is an absolute last resort for us, because we understand that there is a balance that has to be found between public health and the health of the economy. And we've aimed for that throughout this pandemic. So if we take those actions now, if we act at this stage before the big risk happens next week, then we can flatten the curve and we can avoid that stage 5 that would even have us considering the options of scaling back further or closing businesses.
Thank you. Our next question comes from Austonia. It says, has there been an uptick in demand for testing / longer wait times for results given the increasing number of new cases?
We certainly have seen an increased demand for testing. That's through our Austin Public Health testing as well as testing throughout the community. Some of this has to do with the fact that there's more disease happening, so there are more people who are symptomatic or exposed. We're also seeing numbers of individuals who want to get tested before they go home for the holidays. And I do want to mention something that's important. A negative test this week does not provide you any effective information for next week. So again, as we saw with the White House Rose Garden event and other similar events where testing happened beforehand, the testing is only one part of the puzzle. The masking and distancing is still critical. So if folks are choosing to have a gathering despite the warnings, it should be with a mask on, it should be socially distanced.
Thank you. Our next question comes from Community Impact. It says, for Mayor Adler and Judge Brown, if tightened restrictions force more businesses to temporarily close, will the city and county consider offering more rent relief and financial assistance to those businesses and restaurants? Many restaurants particularly have said they won't be able to withstand another closure and aren't profitable at 50% capacity.
Mayor, you're muted.
Staff's really good about making sure that we mute. The city and the county need to do everything that we can to bring as much support as we can to businesses in our community. There are so many that are suffering so greatly, especially in the hospitality industries, restaurants, bars, music venues, and the like. And between us, we have sent out tens of millions of dollars. That said, this crisis has gone on for a long time now, and we need Congress to act. We need the new CARES funding. We needed this new CARES funding 4 months ago, and I felt like it was going to happen 3 months ago. That it became a political issue before the election. Everybody should be reaching out right now to our delegations in Washington, because that's where the funding for this kind of relief needs to come from. And we are doing everything we can, working with our delegations in Washington to urge them to act. And I continue to work with the United States Conference of Mayors to bring that kind of pressure also nationally. And we have a strong delegation here locally that has stepped up and is working hard to bring those dollars back to our community. But that's where that funding needs to come from.
I completely agree with the mayor on this point. I think what we're doing today is trying to avoid getting to that point, and we're trying to ask everyone to stay safe, stay socially distanced, consider not visiting relatives this year if you can, so that we can stay safe and have good holidays and good visits next year and in the future. And at the same time, help our local businesses by following science, taking a lot of precautions right now in an effort to get through this as quickly as possible so that we can all get back to business and supporting our local economy and having our kids go to school. So I'm going to join with the mayor and every other person here in Travis County to ask both at the state level and the federal level to help us out, help our local businesses out as we go through this time period.
Thank you both. The next question here is from CBS Austin. It says, Austin is asking businesses to reduce capacity to 25% to 50%. Is it possible to enforce that request? The mayor says enforcement will be expanded. What does that look like?
Safety is number one. I think the thing that we've done this entire time is that we have provided technical assistance. Our environmental health staff have worked very closely with the restaurants to ensure that they are very safe in their practices. And so that is the number one thing for us, is ensuring that everyone is safe. As a part of our system, we initially start off with technical assistance and provide that support. It is a progressive system, however, because we have the ability to issue citations. And so that is where we are headed at this point, to continue to provide the technical assistance and the initial warnings, but they will turn into citations. And our staff will continue to be very visible in our community, even in instances where we have bars that were formerly bars that have transitioned to be in the restaurant business.
I think it's important to note that, as Director Hayden said, we're trying to provide as much support and assistance as we can to businesses like restaurants, trying to make it easier for restaurants to be able to open up more places outside, and as many other things as we can. But ultimately, enforcement means also looking at individuals, making sure that when they're in groups, they're wearing masks, that we don't have groups gathering in sizes. This is something that isn't just businesses. It's something that we have to look at ourselves and our own conduct. And to be clear, this going to Orange today is asking everybody to take a look at their individual interactions. And by going into Orange at this point, the request of the community is don't go to restaurants and eat inside as much as you may have done in the past. Because now is a time when, as a community, we have to limit our interactions. Just because you have the legal ability to do something does not mean right now that it's the right thing for you or your family or for the community. We're all going to be in this together, and our ability to be able to avoid shutdowns and closing schools is going to depend right now on how we do collectively as a community.
Let me just add one other thing. We've got to understand when we're talking about eating in restaurants or going out to public places, we're not seeing random people infecting one another. We're seeing people who know one another infect one another. So it's okay for families, if you live in the household, to go to a restaurant and have a non-home cooked meal. It's okay to do those kind of things. But what we need to avoid and what we need to limit is the number of people that you're willing to take your mask off in front of. That should be only done with people inside of your household, because that's going to decrease the risk. The pattern that we've been seeing over the past couple of months is that people are going out to restaurants with friends and with neighbors and with larger groups of people. So there's a lot of face-to-face interactions. This disease, what we know about its spread now is the same thing that we knew back in March and April. It's droplet primarily. It's close, person-to-person, face-to-face spread. Those are the situations that we need to avoid. And if we use the advice, if we only go to restaurants and other places like that with our members of our household, we can reduce that risk of transmission.
Thank you. Our next question comes from the Austin American Statesman. It says, are city and county officials planning to shut down county or metropolitan parks like they did in summer as coronavirus cases rise?
So there are no plans yet to close down city metropolitan parks. It is something that's under constant review by Dr. Escott and Director Hayden and our parks staff as we look at the numbers daily. We still want to encourage people to go outside. and being outside is a healthy thing to do. But when you go outside, best to be alone or with people that are in your family, in your household, and don't gather in large groups.
Yeah. Similarly, at the county level, no current plans to do so. And that's frankly why we're here today, asking people to be safe and wear their masks and stay socially distant. Like the mayor said, I personally go running almost every morning and I wear a mask when I do it. And I do it with a member of my household or by myself. And so I would encourage people in every aspect of their life when they're outside of their house to make sure that they're wearing a mask so that we don't get to those points that you're asking about.
Thank you. Our next question comes from Fox 7 News. It says, what is going to happen with schools under stage 4 guidelines?
Again, our guidance for schools under stage 4 is really in relation to those extracurricular activities. And our recommendation there is that for sporting events like football, that they decrease the occupancy of those events. We're asking them to allow the players, allow the coaching staff, and allow parents into the stadiums, but to try to exclude other people, again, to limit that risk. So our hope is that our school districts will be able to do that. We know that we have seen disease transmission in those extracurricular activities. So other measures, such as ensuring that athletes are wearing masks and distancing when possible, will also be helpful to decrease that transmission in the school setting.
Education is number one. It's a number one priority for us. Early on, we developed a school guidance document. It is an interim document. We have the ability to make those changes. We do have an incident command structure that is set up around schools. We will continue to meet with the schools and advise them and provide information to them. But we also provide that information to parents as well through our medical hotline. And so we're going to continue the path that we've been on and provide that guidance. And as things change, we will provide that additional guidance that will give them the support that they can make the best decisions for them and their children.
Thank you. Our next question comes from Austin Chronicle. It says, with cases and hospitalizations continuing to rise, is it possible that bars might not reopen until next year?
So that, like I've said before, I think what we are basing all of our decisions on at the county level and as to anything is looking at science and what is going to get us through this safely. So until the cases start going down, which they are currently not doing, the cases are currently going up in Travis County. The bars are currently closed because of the governor's previous order. And we are going to keep looking at science. We're going to keep looking at the COVID levels every single day. And Dr. Escott, the mayor, and I will continue talking every single day to see how soon it is that we can get back to business as usual and recreation as usual in Travis County. And that's going to depend on everybody's hard work over the next couple of weeks of staying distant, not making that trip that they were thinking about making, and wearing their masks at all times possible.
And I'll just also add to that we're concerned about bars which are now masquerading as restaurants. Bars that have very minimal food service that are able to be open now under the loophole that was created. This is an area of focus for our enforcement efforts because we have seen some patterns of misbehavior and lack of attention to the guidelines from some of those establishments. We've seen large crowds on 6th Street outside of these establishments. I think it's important that the bar industry work hard to sort out how to do this better, how to make things safer. But we know the nature of a bar is that people are drinking alcohol. People are often face to face. And, those two things combined for this pandemic creates a scenario that is very dangerous, particularly as Judge Brown just said, in a time when cases are rapidly increasing. So we have to continue those efforts. We'll continue to monitor the data, and we will make recommendations based on that.
Wonderful. That basically answered the next two questions. I'm going to bop down here to Co-op Radio. It says, is Travis County, the city of Boston, and APH planning a public education campaign to convince vaccine-averse people to take a vaccine?
As a part of our vaccine distribution task force, that is one of our priorities within that process, is to develop the plan, identify the priority populations, but also put in place a communication and marketing strategy. And one of the things that we've done in the past, which seems to work very well, is use some of our leaders in the community that may be willing to be a part of that marketing strategy. And so we are definitely going to be working with in non-traditional settings, as well as with partners, advocates as well, to be able to move this to a place where folks are comfortable with the vaccine. We have also shared in September that the pharmaceutical companies have made a pledge, and they've made a pledge that they would follow all of the existing priorities, including working with the FDA and the review committees. So there will not be any short steps that they will take. And so we are going to continue to work with them and continue to monitor the information that they provide about how efficient the vaccine is. And we're going to be transparent and share that with our community along the way.
Thank you. Our next question comes from Univision. It says, can you go over what phase 4 means, the do's and don'ts for those who might have forgotten?
Sure. The phase 4, and this is on our website at austintexas.gov/COVID-19, which will be updated as we speak. But the primary things for people are that the limitations on gathering are still set at 10 for low-risk individuals. The big change is for high-risk individuals, those who are over the age of 65, those with underlying health conditions, that their gathering should be limited to 2. In addition to that, the recommendation has changed for travel outside the household, and that should be restricted to essential trips only.
Thank you. The next question comes from KXAN. It says, if cases and hospitalizations continue to rise, will city and county officials consider a strategy that defies the governor's order and declaration that there won't be further shutdowns in Texas?
Mayor, you're muted.
Did you get me on?
You are on.
Okay, great. Thank you. Let me get back so I can see you. The governor has said that he would follow the science and the health experts, and if he does that, then he's going to end up taking the action that's going to keep communities like ours safe. We need to be spending our time and energy right now enforcing the rules that are in place and getting everybody to reduce their interactions and masking, because with that, we can avoid getting to a place where any kind of drastic action is necessary. But I would point out that right now there's a crisis in El Paso and Lubbock and Amarillo. The governor sent hundreds of healthcare personnel to them. Really dark clouds are gathering in Tarrant and Dallas counties. Numbers rising in Houston and San Antonio. So unless we can slow our numbers, the governor won't have enough extra healthcare professionals for the growing need in the state. I expect the governor to act appropriately if that point comes, but but we're not there. I think now everyone needs to focus on preventing the worst case scenario from coming before us. And our community just needs to know that we're going to continue as we have done and will at all points to do everything that we can and we need to do to keep our community safe.
Mayor, I'll just add on, as Mayor Adler just said, we have the power as a community to avoid a catastrophic circumstance like El Paso. And we have responded to that call in the past. We responded to it in the spring when we didn't have PPE or testing. We responded in the summer when we faced our initial surge. And I feel confident we'll do it again. And if we can find that balance, if we can reduce our risk while we keep our businesses open, then we'll have the best of both worlds. We'll have an economy that is able to maintain itself until the vaccine is there, and we'll be able to ensure that we can continue to provide care for people for COVID-19 and other illnesses and injuries. Now remember, if we run out of hospital beds, if we run out of ICU beds, we don't run out for just COVID-19, we run out for everything. And this is what we're seeing in West Texas right now. Austin, other jurisdictions are receiving not only COVID-19 patients, but other patients who cannot be cared for in those facilities because they are absolutely overwhelmed. We have to do our best to avoid that situation here.
Thank you. Our next question comes from KVUE. I know you guys have made it clear that schools are a top priority right now. We've seen local teachers who are taking to social media to really express their growing concern with being inside schools. For Dr. Escott, in your opinion, is it safe for teachers to continue in person? Do they need to go all virtual at this point? Also, are there plans to make testing available at all local schools?
I had this conversation last night with my wife, who is a counselor at a local high school. I understand the concern. I understand the fear. I understand the anxiety. But it's important for teachers to understand that we are not seeing transmission in the classroom space. We are seeing it in social gatherings. We're seeing it in football, in volleyball, in cheerleading, in dance team. We are not seeing it when people have their masks on. We're seeing it when they take their masks off. So I think teachers should have some confidence that the measures that are in place, the distancing and the masking and the hand hygiene, is doing an effective job at mitigating that risk. But again, we have to look at efforts, including our schools, to decrease the risk further. And our hope is that we will continue to work together with our superintendents and other stakeholders in the community to ensure that we can keep schools open safely. We have a coalition for our schools that has testing available for schools that are facing surge. Some of the school districts themselves have received allocations from the state for rapid antigen testing. So we will ensure that testing is available should those school districts need it.
Thank you. Our next question comes from Austonia. It says, is there any evidence that Austonia...
Can I touch on that?
Yes, sorry.
That's okay. Dr. Escott, I think one thing that might be worth touching base on is as we go into Thanksgiving, obviously we're asking and suggesting to people that they spend that time at home with their families. We also recognize the reality that there'll probably be some families that are going to travel over Thanksgiving, which is not what is encouraged. But parents should think about whether or not, if they do travel with children, whether it's appropriate or right for them to send those children to school that first week, coming back from that in order to help keep the schools safe. But I'm particularly concerned about that week directly following Thanksgiving, and probably something that needs further discussion with you and for the schools and parents to be thinking about.
Yes, Mayor, I completely agree with that. And as you point out, that is the prime time for risk in that first week to 10 days following Thanksgiving. So if parents who decide to travel or to be in gatherings with people outside their household, the best advice there is to be virtual that week following Thanksgiving. To be tested at the end of that week to ensure that, or help to ensure that their child is COVID negative before they go back to school. Again, we have to all look at opportunities to help mitigate that threat from Thanksgiving, and that is one way to do it.
I encourage parents that if they are thinking about what type of plans they need to make once they return with their children after the holidays, if they travel, I would suggest that they reach out to the schools and have that conversation, because I understand that there is a choice. Once you're virtual, you're virtual. Once you're in person, you're in person. And so I would suggest that parents go ahead and reach out to the school districts, have that proactive conversation with them, and make those arrangements about, how I can continue to have my child educated once we return. And I am doing this because I'm thinking about safety first. I'm thinking about the students, and I'm thinking about my family. And so I know that the school districts would be willing to work with the families if they just reach out to the schools and have that individual conversation with them.
Thank you. The next question is from Austonia. It says, is there any evidence that Austinites are changing their behavior given the warnings from local officials and reports of a surge?
Well, I think I should say that we'll see. We've just started seeing the increase. We know it takes 2 or 3 weeks to see meaningful change. Our predictions right now, our projections from UT suggest that we may plateau for the next week or so, and then after Thanksgiving take off again. So that may be some impact of that post-Halloween messaging that we've been putting out. But again, we've got to sustain the vigilance. Right now is a time when literally the vaccine is almost in our hands. So it's worth buckling down, strengthening the vigilance for a little bit longer so that we can prevent needless hospitalizations and needless deaths. This has been an unimaginable disaster for America, and we can really work hard to prevent it from getting worse. But now's the time. It's not later. It's not 2021. It's today.
I would also like to add that we have asked Austin and Travis County a call to action. We're doing that today, but we've done that in the past. And Austin and Travis County citizens have definitely stepped up. They've also taken that individual initiative. They've looked out for their families and friends and loved ones. And so we've done it before, and I am fully confident that we can do it. We can do it again. We reach out early enough, and as Dr. Escott has showed, those are our forecasts. And so if we make the change now, things can definitely be better. We can reduce the number of hospitalizations. We can bring down our positivity rate, and we've done it before, and I'm confident we can do it again.
Alrighty, I think we have time for one more quick question. This last one is from CBS Austin. It says, other jurisdictions have said that contact tracing is identifying big box stores and popular restaurants as spreader locations. Is APH seeing the same situation?
We are not seeing in our contact tracing. What we are really continuing to tie our positivity rate to are the gatherings, the parties that individuals are attending. And we're also from a school perspective, as Dr. Escott has stated, we are seeing it in extracurriculum. So we're seeing things that are happening outside of the school that students and or parents are testing positive. And so it's those decisions that individuals are making to continue to have behavior like we're not in a pandemic response. And so that is our goal, is we really want everyone to take a step back and evaluate your behavior and make the most appropriate changes that you can make so we can just finish this race strong.
All right, I think we're done with the question portion. I really appreciate you guys taking the time every week to do this, and I'm going to pass it over.
Thank you. At this time, we would like to start our closing remarks. Dr. Escott, we will begin with you and follow in the same pattern that we did as when we opened.
So thank you. And, again, our cases are rising, our hospitalizations are rising, our ICUs are getting more full at this stage. We still have capacity here. Our hospitals are still open and functioning and are not in crisis right now. Now is the time to act. Because we had to change our ICU capacity, we are now at stage 4, having surpassed the threshold of 30 new admissions on Sunday. And we have a significant threat in the coming week, and that is Thanksgiving. We need to be mindful of the risk that Thanksgiving poses in our community, and we need to continue traditions in a different way to ensure that we can protect ourselves, protect our family, and to protect our community.
This is a call to action. We are wanting you to really think about the older individuals in your life, whether it's your parents, your grandparents, people that have mentored you, your godparents, people that you love so dearly. We are wanting you to really think about, how has my behavior changed? How can I recommit? I really want you to think about what motivates you as an individual. And if it's your loved ones and keeping them safe, or if it is making sure that I have children and I want to make sure I have nieces and nephews and I want to keep them safe, or I have, older people in my family that I really want to keep safe. So think about what motivates you. We all have to establish new traditions. I think we're in such a virtual world now. And so how can you share that with others? Use social media. Send an email about what you and your family are going to do this year to really, really change and put safety first. We understand that individuals are really getting tired. We have people in our community that have really struggled with mental health challenges. Please reach out to our crisis hotline and contact them and have those conversations. For those of you that have family members that really struggle with mental health, whether it's depression or anxiety, please reach out to them. Establish a process where you can let them know that no matter time of day or night, that you're going to be available for them. You're going to be their safety partner. And you're going to be that person that can really help them safely navigate through. You'll help them, connect them to the help that they need if they have any mental health challenges. In closing, we have testing availability. We have extended our hours of operation. So please either go onto our website and schedule to take a test, or call our medical hotline number to schedule to take a test and walk into one of our sites. Thank you.
Thanks. I just want to follow up with a direct answer to Telemundo about their question earlier. En etapa 4, para personas de alto riesgo, que son personas con problemas de salud o que son mayores de la edad de 65, quédate en casa, aparte de viajes esenciales. No se reúne con más de una otra persona a la vez y lleva máscara siempre. Lleva máscara siempre cuando esté fuera de casa. Y para personas de bajo riesgo, no se reúne con grupos más de 10. Lleva máscara siempre. Y siempre lleva la máscara cuando esté fuera de la casa. Y evitar comer adentro de restaurantes, en el interior de restaurantes si puede. Thank you very much, and I'll pass it to the next person.
I think I'm going to close. The reason that we moved to orange, risk level 4, is because with more discipline, we can avoid red, risk level 5, and the closing of schools and other businesses. By our actions together, especially Thanksgiving, we get to decide how badly we want to keep schools open. By our actions, we're going to show how serious we are about whether we want to stop the increase in hospitalizations. The bottom line here is we have control over our future with our conduct. Now, we've done this before. We just need to do it again. The vaccine is close. We're almost there. We need to commit just a little bit longer. Mask, small groups, stay home when you can, distance. Look at your family and remember who you are doing this for. Don't jeopardize years of future holidays for you or for other Austin families by taking unnecessary risks this Thanksgiving. We're in this together, and we can get this done. I want to thank Dr. Escott, Director Hayden, and their staffs for their 24/7 work that you all have been doing to keep our community safe. Thank you.
Thank you. That concludes our news conference for today. Thank you to APH Director Stephanie Hayden, Dr. Mark Escott, County Judge Andy Brown, Austin Mayor Steve Adler, and our KVUE pool reporter. Thank you. Have a great day.